Good morning, everyone. Thanks for coming. My name is Senator Judy Seeberger. I represent District 41 in the East Metro. I'm also a paramedic, and I still work the streets. My friend here and colleague, Representative John Huot, retired from EMS after a long career. We know what it's like to be out on the streets, and following the incredible amount of gun violence we've seen this summer, starting with the assassinations in June and going up through this past few weeks, Representative Huot and I thought it was important to talk to the Hennepin County medics and emergency medical dispatchers who are on the front lines of these kinds of traumatic calls. We held a listening session yesterday to kind of let them debrief, hear about what they've been going through, hear about their experiences dealing with traumatic calls and just simply the amount of gun violence that we've seen over the course of this summer. And it was informative and eye-opening. That's why we've invited them here today to talk about what it's like to be on the streets working as a medic, what it's like to be on the other end of the phone when you're an emergency medical dispatcher, to hear and be a part of these kinds of traumatic incidents. Representative Huot and I have spent the last couple of sessions, the last 3 sessions, working on emergency medical services issues. We have established a new Office of Emergency Services. We've done work toward reimbursement and treatment non-transport funds, things to try to help improve the delivery of pre-hospital care here in the state of Minnesota. But there's a lot of work to be done. There's a lot more that we need to do. We have medics on the street who are experiencing burnout. We have systems in greater Minnesota that are on the verge of collapse. These are issues that are important and are things that we are working on currently and will continue to work on as long as we're in the legislature. But today is about recognizing our medics and our dispatchers, particularly those in Hennepin County, who have really been at the front lines of all the things that have been going on lately. So with that said, I'm going to turn it over to Representative John Huot.
Good morning, and thank you for coming. As the Senator said, I'm Representative John Huot. I represent Rosemount, Apple Valley, Egan. This has been a passion of mine, naturally, because I come from this field. When I woke up that morning, all I had to think about is my colleagues that I've now retired from are out there, and they're churning the next call. There's no time. They maybe have dropped off a pediatric patient at a trauma center, and now they're going out on the next call to help with some person that needs their hand held to get to the hospital. Even from the incident that unfortunately happened to my colleague this year, the medics were there. The medics are the ones that have to determine who's going, who's not. They saved a lot of lives this summer. Let's face it, this summer has been really bad for our public safety entity in Minneapolis or in St. Paul. These are challenges, and we have to look at EMS differently. I'm not going to take much more time, but we'll take questions at the end. But this goes not only to these wonderful people that stand behind me, but it goes further than this. The country is suffering, and now there's a possibility that we're going to have to cut back even more. Their funding is totally screwed up on how we do operations. We cannot, I mean, if you get paid to transport somebody, that's something wrong with that. And so I don't want to get into that too deep today, but it's just a cyclical story that we've been telling you for the last few years, and it's got to change because they need a break. They need to catch their breath. You can't expect them to go to a hospital, have a terrible situation. You got another call. And you'll hear from the dispatchers today and what they went through that morning or what they go through every morning. This incident is one of many. Remember, those last 3 days before this incident were there. And so, but there's ones that that the press never covers, that no one ever does. And so it continues. So I'm going to bring up the president of the Hennepin County Paramedic Association, Shane Hollow.
Thank you. As Representative Huot said, my name is Shane Hallow. I have the privilege of serving as the president of the Hennepin County Association of Paramedics and EMTs. We represent over 200 paramedics, dispatchers, and EMTs that work for Hennepin County EMS. And in addition, I've been a Hennepin County paramedic for 12 years, full-time. I first want to acknowledge the heartbreaking tragedy that occurred at Annunciation Church, and our deepest condolences go out to the families of Harper Moisky and Fletcher Merkel, and we continue to keep all of the victims and those impacted in our thoughts. I also want to acknowledge and recognize the heroic actions of the paramedics, dispatchers, firefighters, and police officers who responded to this tragedy. There is no question in my mind that the work of our paramedics and dispatchers saved lives that day, and we are incredibly proud of the care and professionalism that they showed under unimaginable circumstances. This tragedy underscores the heavy burdens that first responders carry, but it is not only incidents like the shooting at Annunciation Church that take a toll. Every day, paramedics, EMTs, and dispatchers face the most traumatic, violent, and heartbreaking situations imaginable. The impact comes not only from violence, but from relentless exposure to life's most painful moments: death, illness, grief. When the call ends, we are expected to move immediately to the next call with no time, no opportunity to process what we had just experienced. Adding to that burden, EMS has become the safety net of the entire healthcare system, answering countless 911 calls that are simply not true emergencies, but still demand our time, energy, and our compassion. And I think it's important to add that despite those challenges, our members are willing to do that day in and day out, even with that impact on them. The reality is simple. EMS providers are suffering. Rates of post-traumatic stress disorder, mental health issues, and burnout among EMS providers are far higher than that of any other job class. Unlike many other professions, we do not work in a sterile, controlled environment. We work in the community, and the trauma we absorb engages all of our senses. And those triggers can be triggered at many different moments in our lives, at home, driving around, on another call that is unrelated to a tragic call, per se. Many of our members have been forced to take leave for PTSD and other work-related mental health issues due to relentless exposure to trauma, long hours, and inadequate staffing. These are not just statistics, these are our coworkers, our friends, and our family, breaking under the weight of a system that refuses to support them. Too often, our industry would rather pretend that everything is fine than confront the reality and take responsibility for change. Our members are trapped in an unsustainable system that places profits and call volume above people, the people that do the job. Numbers are prioritized over individuals, speed over safety, and short-term optics over long-term sustainability. We have called on our department for repeatedly for change. EMS Chief Marty Shear has failed to meaningfully respond. Time and time again, our members have been denied time off for traumatic incidents, even when they have admitted they are struggling. Concerns about mental health have been dismissed, delayed, ignored. Leadership has chosen productivity over people, discipline over dialogue, and silence over solutions. This failure not only endangers the well-being of our workforce, but it also undermines the patient care that we provide and community safety. What we need now is not words or thank you emails. We need resources that are effective, leadership that prioritizes mental health. We need structured recovery time for traumatic incidents and proactive policies to prevent burnout. This is not about politics. This is not about personalities. This is about survival for our members, the providers who give everything to the community, and for the patients who depend on them in their worst moments. Inaction is no longer acceptable. Leadership across the board must take responsibility for protecting the mental health of the very people they rely on to provide care. Without the providers, this service will not exist. First responder mental health matters, and ignoring it is not leadership. True leadership means standing with our workforce, listening to their experiences, and taking real action. And this is what we need. We'd like to call on the governor and the legislature to address EMS provider wellness and work to create a more sustainable system in the future. And Dan Kiley, our chief dispatch steward, will come
Well, good morning, everyone. My name is Daniel Kiley, K-I-L-E-Y. I have the absolute pleasure of being the Chief Steward of Emergency Medical Dispatchers for Hennepin Healthcare on behalf of the Hennepin County Association of Paramedics and EMTs. I've been with Hennepin EMS for the last 2 years full-time, but come with an extensive public safety background for the last 15 years. Last week, our dispatchers, paramedics, bravely answered the call that no first responder ever wants to receive. Dispatchers received frantic calls from within inside the church and then immediately began a large-scale rescue effort. These dispatchers demonstrated the highest level of professionalism, competency, and precision under the chaos that I have witnessed in my 15 years of public safety. Because of the unmatched efforts and skill of every dispatcher and every first responder on scene, many lives were saved that day. But what happened after the shooting is what must be brought to light. Following this senseless tragedy, our leadership publicly stated that the responders were, and I quote, doing pretty well, and that they would be given the rest of the day off. In reality, behind the scenes, responders were grieving while still being told to actively remain available for calls. There were little to no effort to bring additional staff to backfill those who desperately needed to go home, and the responders and dispatchers didn't know how to ask for help because we've never been taught how to ask for help. How can you ask for help when you are still actively helping the ones who need help the most? Meanwhile, leaders, after the shooting, had their doors closed for hours while they were inside their offices. This led paramedics and dispatchers to believe that they were on their own. After the leadership's false assurances, closed doors, hollow promises, many of our dispatchers are feeling invisible, deeply hurt, but most importantly, betrayed. What the public and the media has witnessed is performance leadership. What our dispatchers and paramedics are working in is the impact of a leadership vacuum and a culture of excuses from the top. This dereliction of duty does not just harm EMS staff, it harms the public we serve. Leadership's public words did not match their actions, and that is a catastrophic failure of leadership and accountability. This moment cannot end with sympathetic words and no follow-through. What is needed now is active change from the top. Change in how dispatchers are recognized, change in how critical incidents are handled, and change in how leadership backs its words with meaningful actions. Anything less risks eroding the very trust that keeps this system strong. Dispatchers cannot be treated as an afterthought when tragedy strikes. We are the first link in the chain, and if we aren't a part of that chain, the whole system fails without us. So I am calling on leadership to act, to show accountability, to rebuild trust to every member of EMS, from the field to the dispatch center. I want to make sure that dispatch receives respect and the support they deserve. Dispatchers need real, effective support from leadership with real-world solutions brought forth by the dispatchers, not to be told, see you tomorrow, after an incredible, tragic event that we witnessed last week. On that tragic day, dispatchers showed professionalism, competency, and precision under unthinkable pressure. We were the steady voice in the chaos, and now it is time for leadership to match that same level of courage, not with more statements, but with decisive action and change. Dispatchers showed up for the community, not last week, but every day. It is time for leadership to show up for us. Without leadership showing up for us, I'm truly alarmed by what the future holds for not only dispatch centers, but EMS as a whole. Thank you very much.
Jason.
Hello, my name is Jason Snetting. I'm a union steward with HCAPE, and I work as a paramedic for Hennepin EMS. I was involved in the response to and transported patients from the scene of the Annunciation Church shooting this past week. What occurred that day was an unthinkable event. Unfortunately, as anyone who works in our field knows, we have to think of these events all too frequently. That tragedy was actually the second mass shooting that had occurred within a 24-hour period in our service area. The previous day, there had been 7 people shot on a Minneapolis street corner, as well as 2 other fatal shootings that night. as well as a multitude of other emergencies that would be considered routine. The event that occurred at Annunciation was not routine. Yet, many of us continue to run calls throughout the rest of the day. Normally, we drop off our patients, we go to the next call, we show up the next day, and we do it all again. That is what is expected of us. This was different. People needed time and distance. I got that distance because I was not scheduled to work the next couple of days. Not all of my coworkers were that lucky. One of the things that has caused me the greatest hurt during all of this was returning to work to hear that some of my colleagues directly involved with the event had received pushback from management when trying to take time away to deal with the impact. I cannot explain to you how hard it is for many of us to ask for that time. Our training and our instincts tell us that we need to get to the next call. I believe that sometimes, because of our role in the medical field, especially in EMS, we are expected to deal with traumatic events differently. After all, we witness human suffering and tragedy on a daily basis. Even so, there are events like this that can shake even the most seasoned professionals amongst us. And while this may be the job that we signed up for, that does not mean that we shouldn't try to limit the toll that it will inevitably take on our minds and bodies. I work with a truly incredible group of people who never want to be a burden on others and who never want to be the one that needs the help. If we wait for these people to tell us that they need help, to tell us that they need to step away, if we make these people beg for that, I promise you it is too late. The damage is done. Unfortunately, it's been proved to me numerous times that we cannot rely on the good graces of our employers to give us the support we need after events such as last week's or when the cumulative stress of the job becomes too much. We need protection and we need help. Thank you.
I think we're willing to take questions now if anyone has any.
From a legislative standpoint, I know last year, I remember we covered a press conference with a lot of first responders. You're talking about getting some funding in the budget, and it got that, I believe. Is there something, next session you're gonna be pushing specifically when it comes to either wellness or just, increasing staffing or budget?
Representative Huot and I have been talking a lot about that. What can we do? Coming out of yesterday's listening session, I think we got a little bit different perspective. When we're hearing about call after call after call and burnout and inability to get something to eat or go to the bathroom. I think what people don't realize is when you're on a truck and you're in a busy service, your shift is 12 hours, 13 hours, 16 hours long. And that's a long time to be constantly running and constantly churning. Representative Huot and I were talking about how can we build in breaks? Is there a possibility to build in some protected break time to give folks that are constantly on call an opportunity to rest? And it's one thing to have a space of a half an hour between calls. That's not a true break because you're always on alert, waiting for that tone to drop. But if you know you have 30 minutes where you can shut your mind off, shut your radio off, I think something like that would go a long way. It's a good start. But we can't have medics trying to squeeze a bathroom break in behind a tree or using an emesis bag in the back of the rig because they're going so fast and they have so many pending calls that they have absolutely no time to use the bathroom. That's not okay.
Oops. Sorry about that, folks. I'm not going to take the call, okay? Yeah, he'll have to, he's not important anyway, so anyways. The senator is exactly right that we have to look at a global picture. The stories you heard are not only to HCMC. These are common throughout any service we see throughout the country that is pushed with the way this is funded. We do not recognize EMS as an essential service in the state. We do not recognize it across the country, pretty much. We always look at it as, forgive my French here, a bastard child of police or fire. Trust me, they do more calls than most of the public safety agencies around, and that goes throughout the country. We have a financial challenge, and we have to, your values are where you you put your budget. Something that was said in one of the press conferences that I think is so important, and Judy and I have been trying to get this going. I am sick and tired of legislators saying they support and back first responders, these particular first responders. They all want photos with them. That's great. But it's finally time to do something. As the principal of the school said, it's yes, pray, but move your feet. Stop talking and move your feet, because that's what has to happen in EMS. They need our attention. This depends on you, because who knows who's going to be the next person. It could be me. Trust me, when I ref basketball, the first thing I do is, where's the AED? It's going to be for me, probably. So, but the point is that I'm saying that we need to take care of us, because the way things are going, the way we see the trending, doesn't matter who's in the White House or whatever, this is access to healthcare, and it's gotten worse. So we really need to review this, and yes, there is some legislative things that we're looking at. I don't like legislating businesses. I don't like going in there and saying that we're going to control the businesses, but these are different people. These are public servants. They have to be it. And doggone it, we did this to the airline industry years ago when we put a bunch of regulations in to say that pilots have to be checked, crews have to be checked, because that's all about safety. These individuals are going from call to call, running through your streets with equipment, sirens and lights. Let's look at them. Let's make sure they're safe. Let's make sure they're ready. And don't also forget the other psyche that plays on this. Most of these people behind me have young kids. And I got to tell you, when I was working the street, it was one of the hardest things to do. Every night you spent with your kids, because you don't know, especially if you had a pediatric run. This plays on all of our psyches. And so, yeah, there's stuff we can do, and I'm hoping to do more. I'm sorry, next question.
If Governor Walz calls this special as it relates to, gun violence and whatnot, would you consider bringing up, EMS support as something to push during that? Or do you think you'd need a little bit more time and bring this back up in February?
Yeah,
This is a part of the conversation. This is an ongoing conversation that we've had for a really long time. I think it would have to be part of the conversation. I don't know that we can come up with solutions if a special session were called next week, next month. This has been something that Representative Huot and I have been working on for a very long time. But if there's an opportunity to do something, we will certainly be there pushing for it and incorporating it into whatever it is we can get done.
For some of the union leaders, have you had any dialogue with management? Have they, talked to you at all? Have you been able to sit down with them?
Yeah, I can answer that. We shortly after, I can back up even more. So for 4 years, we've been trying to get contract language into our contract to address critical incident administrative leave to allow for this type of break without question and to have a process be solidified. So that's one piece of it. The second piece is we've worked on policy with our managers to give our crews a 30-minute break after a critical incident, specific types of calls, so like a pediatric cardiac arrest, a shooting that involves a child, a mass casualty incident, et cetera. And we were told no. So we had a whole draft policy that outlined this. We worked on it with other managers. We were told no by the leader of our department. Following the shooting, we had conversations about getting our people, we had to make phone calls and make arrangements to try and get our people time off. That's not our job to do. They should be doing that automatically. It's not something that we have to call and say, hey, why are these people working tomorrow? Why are these people not still working on the street 3 hours after they went to the shooting? And the other thing I'll say is we go to the table next week with our employer, and we'll gladly address that issue if they're willing to come with some common sense solutions. So.
I think part of it has to do with call volume too. When we're talking about, I think you can hear in the tone of voice, there's burnout. It's a heavy burden to go from call to call. I have not worked for Hennepin Healthcare, but I have worked for a busy metropolitan service, and it can take its toll. when you're running call after call, when you're pulling into the hospital with one patient and dispatch is on the radio saying, I've got another one waiting for you, let me know when you clear. It's like, okay, I have to go to the bathroom, I'm a little hungry, and they keep calling and keep pinging. And it's not dispatch's fault. It's the volume of calls that are coming in. And I think sometimes people who are not in this field are surprised to realize that many times we're dealing with things that are not an emergency. The E in EMS stands for emergency, but not everybody treats it that way. Sometimes people call an ambulance thinking they're gonna get back to be seen quicker. It's not true. We're gonna pick you up, we're gonna bring you right into the waiting room where you would have been if you could have driven yourself. Some of these things are what is driving the burnout. That's part of it. So I think these are all things that Representative Huot and I kind of put into the mix and talk about how can we fix not only the situation with our people on the street and our dispatchers, but go further upstream and solve some of the problems so EMS is not such a safety net.
And I think that and again, they definitely have some labor management issues, but again, it's not uncommon to see this in every ambulance service that we talk to. I'm gonna say something and I'm gonna give you guys an assignment. Look at system status management and look at how that has changed EMS. I'm not gonna tell you more because I would like you guys to do your homework. It's really an interesting thing, and it's about crew utilization and where they're at and how much they get used during that time, and it all comes down to money. And so I encourage you to look at system status management, because when that came in and I was heading out of EMS at that time, you saw the burnout rate go high. And so it's not always about the numbers, and I'm not saying Hennepin County is always about the numbers. They have their own issues over there as far as, we all saw that in the session, and again, legislators failed to give them what they needed to operate at the hospital. So there's a lot of blame to go around here, but we got to do something. And Hennepin County is one of our biggest, these guys are our biggest safety net. And they don't just cover Hennepin County, they cover the whole state. The dispatch center, I was hearing stories about that yesterday, that they have numerous counties that file into them. And they got so much volume, I just don't know how they do it. So we got to change, and we need your help to do that.
Would either of you be willing to answer an off-topic question?
Depends.
I'm
Go ahead.
wondering if either of you support some of the proposals to ban assault weapons.
What I'm doing is reviewing all the proposals. I'm interested to see what's coming in. I am encouraged that I saw the House Republicans come in with a proposal. I think we need to get together and figure out what we can pass. We can't do anything without each other, and so it's going to be important for all of us to speak. But I don't want to get off topic. I think we're here today to focus on our Hennepin County medics and dispatchers and the role of EMS in the state as a whole. John?
And not to say this isn't a focus, it is. Because if we clean up some of that, maybe this won't be the problem. But I have to refer you to our House chairs. I know that they're working diligently on this to see what we can do. What they can't do, and I'm sick of the politics that are playing out in this, don't bring us back just to get some votes. Bring us back if we got substance. Every time, an incident happens, and that's terrible, but make sure that we can actually get something done. That's what I focus on, and I know my chairs are focused on that too. So I know the governor is grieving. I know that all of us are in a bad situation now with the summer and this, but give me something that is going to work. Stop talking and move your feet. Thank you.
From one of the EMS people, just what would be the number one ask from the legislature? Is that just funding? Is it some policy that you're looking at?
I think in my mind, everything funnels to funding. We have to find a way to make EMS sustainable, and the current model is not sustainable. It rides on the backs of the people doing the work. We have to be, what I would say, paid to be ready to provide the service, and then I think other things will fall into place. It's hard to give some credit. You don't bill unless the wheels are moving. So services want the wheels moving. The issue is the wheels moving means that everybody behind me, everybody who I work with is working to make money. And that has to change.
We've said this, and Judy and I have, Senator and I have both talked about this. The model is broken. They're paid when they move a patient, which I think is bad. And then on top of that, readiness. Our police are paid by readiness. Our firefighters are paid with readiness. They are truly in that scope, and I don't understand why anywhere in the country we're not getting to that. I mean, this is ridiculous, and that's what the burnout is that, yes, their managers have to push them so they don't have to talk to their bosses. So, I mean, it's a screwed up system, and I hope in my lifetime I at least see a projection of going the right way on this. If Washington wants to do something, this is what they can do. Identify these people as somebody that needs to be paid for readiness and not in the Medicare, Medicaid world. Thank you.
Thanks, folks.
Thank you, appreciate it. Thank you.
Guys, thank you.
Yeah.